Welcome, Mike, and we're really grateful to have you been part of the organizing committee. You know, your contacts and knowledge are just incredible. We're fortunate that Mike agreed to do a presentation for us today with the specifics of elder abuse here in Wisconsin. So the title of his presentation is The Impact and Response to Elder Abuse in Wisconsin. Mike, let me turn it over to you. And remember, everyone, if you have questions as we go along the way, enter it in your chat panel, and toward the end of the hour, Mike will be seeing those and be able to deal with them, okay? Thanks a lot.
Thanks, Mike. So I'm just going to kind of go over what we're going to be covering here in my session, and I'm going to just give you some information to kind of study the scope of the problem of elder abuse in Wisconsin. Then I'm going to share some information about the ongoing efforts, some of the stuff that Bonnie had alluded to during her presentation. And then at the end, I'm going to bring in a kind of an expert panel from APS, law enforcement, and from kind of that financial side of things. Much smarter women than I am. I'll bring them in, two attorneys and one law enforcement officer. So that can hopefully reiterate things for me and all of you out there that I'm sharing with you today. So Bonnie, you know, she showed a lot of great examples here of what's happening. Some of those stories in Seattle and other parts of the state that she shared were really impactful. But you know, hey, is this happening in Wisconsin? Yes, absolutely, it's happening in Wisconsin. And I know the Adult Protective Services workers who are on the front lines out there, or other people that work in this field, have seen this throughout their careers. The reports of elder abuse sadly have tripled here in Wisconsin from 2001 to 2019. And so I think Bonnie hit on this point, and someone else in the question box had also alluded to this, that there's a lot of cases that are out there that are unknown. So for all of those reports in Wisconsin that we know about, those are the ones, and I'll show you the slide in a second here. There's another 23 that are unknown out there. So it's really a huge problem, and a lot of cases that are unknown because of victims and the perpetrators and their closeness to those individuals are a reason why a lot of it's underreported. So here's some other data. Higher risk of death once you're a victim of elder abuse, and of course the financial toll is just tremendous. I think this is I've seen data that's higher than $36 billion a year. I think this is kind of more of the middle of the road in terms of the losses and the impact on taxpayers that we see over time in financial cases. So here's the data. So this isn't, whenever I see a chart these days, I get scared because I think we're talking about COVID cases, but this is the 2001 to 2019, cases, and these are the reported cases that come into your county adult protective services and ones that they're tracking. So this is a problem that is large and growing, and it's going to continue to grow, I believe, in the future, which I'll get to in a little bit. So what we're talking about again, who are the abusers? They're primarily family members. Bonnie touched on this just a little bit. What we're looking at predominantly in those reported cases is not your scams or frauds. Of course, those happen, and they're very important that we pursue those cases. Or sometimes people think about abuse that's occurring in facilities, and obviously that does happen. Bonnie touched on that, but the vast majority of it's perpetrators that are known to that individual, and they usually have some kind of issues themselves, criminal records or mental health problems or potentially financial problems. And so that can make it difficult to pursue for law enforcement or a victim to cooperate once they do know that they're a family member or they've been in a relationship for that person with maybe 50, 60 plus years, and it's really a challenge for them to come forward. So here's the data, just to prove you this is from Wisconsin. This is the data that the Department of Health Services puts together from the county. So as you see, predominantly sons and daughters and spouses. They're really the perpetrators, and other family members or relatives are commonly the people that are the perpetrators in these cases. And I'm also going to show a slide just to show you where are these people. So again, pointing, nursing homes and assisted living facilities are happening. It's probably underreported in theirs, but probably a predominant number of these people are out on their own. And what's interesting to me, a lot of these people are alone, and isolation is a huge issue, especially when you're talking about COVID these days. That's where people are going to try to go after those older adults when they know that they're isolated, know that they can't reach out to other people, or might have a limited capacity to be able to reach other trusted individuals to assist them. So it can be very, very scary for those older adults. So I kind of alluded to this again a little bit earlier. Is this going to get any bit better in the years to come? I try to be optimistic about things, but I don't think they will, because our older adult population is going to increase by 72% in the coming years. And, the baby boomer generation, as many of you know, is going to continue to soar. And a lot of those older adults are going to be living longer. So we're going to deal with unique issues like dementia. So that's going to double up to almost 250,000 people in Wisconsin alone that are probably going to be diagnosed by estimates that have come together in the recent years. So we're going to deal with a lot of challenges. And so put that in perspective, look back into 2010, we had almost 14% of our overall population that was 65 plus. So by 2040, it's going to jump up to 10%. So overall population in Wisconsin is going to be about 24% is going to be 65 plus population. Of course, a lot of those individuals will be safe and be able to take care of themselves, but there's going to be a larger percentage of those people that will be targeted and probably victims of elder abuse. And so this is going to proportionally impact, based on the data that we've seen, where those older adults are going to be living. They're going to be living in a lot of rural areas in Wisconsin. And as we know, for those of you that work out in those rural areas, there's usually even less resources. Not to say that our more urban centers have tons of resources. There's going to be probably even less in these rural areas. So it's going to be a big challenge proportionally for those rural areas to deal with once they have to serve this population at a greater percentage. So this is just a chart that shows you that population increasing over the years, just so you can kind of visually see that the population of Wisconsin is going to go up and, produce a whole host of challenges, not just for adult protective services or law enforcement or other people that may be investigating elder abuse crimes. We kind of think of it that, there might be other healthcare needs and things that we're going to have to deal with. That will be a challenge and a strain on resources over time. So I'm going to tee up our next video here. It's going to talk about collaboration. So Bonnie had talked about this. It's so important to be able to work with other people within the communities. And so I'm going to show you a short video from the National Clearinghouse on Abuse in Later Life, and it shows some of the different partners out there and kind of their perspective on why collaboration is so important in this area.
By definition, collaboration is essentially about bringing individuals, organizations, and systems together around a common purpose. I think in the context of abuse in later life, collaboration is a very critical component of having an effective response to abuse in later life. I think that because as we know, elder abuse and abuse in later life cases are very complex, and rarely can one institution or organization or individual effectively address all of the complex needs of an older victim. And what is really needed is collaboration amongst and between key interveners and key partners in abuse in later life cases.
To be collaborating within the community means knowing the community. So that means identifying, thinking outside the box. You know, we typically think about area agency on aging, we typically think about adult protective services, we typically think about, and it may be different acronyms depending on where people live, triads, elder abuse task force. We typically think about the luncheon programs, the senior health fairs, all of those. And thinking outside the box is really important. So it means making a phone call, means showing up for a meeting, it means being productive with that time. It's the opportunity to meet each other. It's also the opportunity to figure out how we strengthen each other's services.
One thing that we've done is partner with the agencies that are in Milwaukee that are culturally specific. We always make these statements that you can learn about another culture or educate yourself and you could be versed in it. And it sounds good, but it's better when you can do a collaboration or a collective with agencies that are providing specific culturally based services and allow those individuals in your facility.
You can begin to provide and learn from each other. None of us have the answers all ourselves. That's the beauty of working collaboratively, is we build on the expertise of others, all for the goal of ensuring that these victims, that one survivor, gets what he or she needs to be able to move forward and heal, whether it's criminal justice, whether it's adult protective services, whether it's domestic violence, sexual assault, or disability services. We have to find out from each other, in your field, what works, and in your field, what doesn't work, so that we're not repeating the same mistakes that other organizations have figured out 20 years ago. It's building upon, working from, and really elevating the collective knowledge. Why? Because victims and survivors matter, and we can do more by learning from each other how best to figure that out for folks who don't fit the typical profile of who we think of as victims and survivors of domestic and sexual violence.
Bear with me for a moment. I'm just trying to get back over to my presentation. There we go. So I'm going to kind of move on and talk about what we've been doing in Wisconsin around elder abuse. And so, again, collaboration really has been something that myself and others have identified as a key to our success in this area. And so in 2017, we understood that this was a large problem. Just by, seeing that data that I showed you before, you could easily understand that it's a problem and it's growing within our state. And so the Attorney General came to me at that point to get an understanding of what was happening, and he wanted to obviously work on this issue, and came to me to say, hey, let's identify what can we do at DOJ from our perspective to assist other partners. And what it kind of hit it home for him, he had some individuals from his church that came to him and said, hey, we were just perpetrated on by another individual for some financial exploitation. And so that really kind of hit it home for him that this is real and happening. So I was tasked with being able to learn what the issue is, and started to bring together more of a coordinated response on it. So I got together with just about everybody under the sun that I could find, and we packed them in a room and held some listening sessions with those key stakeholders to really get a download on what's happening out there in the field, because we have a small perspective on things. At DOJ, we may be working with law enforcement officers or prosecutors, or maybe working with some victim service representatives. Just really kind of our scope of things is very, very different than the people that work there day to day and see see what happens with victims in the field. So we brought them in really to get a download, and it was kind of overwhelming to hear all of the challenges that were out there. But we started to work right away, and starting to develop recommendations, and we created a multidisciplinary task force. So we took some of those key stakeholders, put them on a task force to really start to dig in deeper and provide some solutions. And so I'm going to talk a little bit about what we developed some tools and sought some funding, which I'll tell you about some of our grant programs, and also doing some public awareness out there, which was really critical, because as someone identified in the chat box earlier, is there's a lot of people that might not be comfortable going out there and identifying themselves as a victim, or might not even know that they're a victim of themselves, or they don't want to get help because it's their son or daughter or other relative that's the perpetrator. So public awareness is very important. So our task force, we created in 2017 with many partners, as you can see listed there, and that's just a kind of a short description of a larger group that was there, and really provided input throughout the year plus that we had met, and continue to meet with that group from time to time. But a main focus of the task force was supporting some legislative proposals, and it was really great to get all these people's perspectives together to make sure we were on target, and that unanimously moved through our task force. And some of those legislative proposals included expediting cases and preserving testimony through deposition. So what we had discovered, there's a lot of cases that become challenging because, as you saw the statistic I shared earlier, those individuals that have been victims of abuse, they're much higher likelihood of death, 300%, as I said before. So we sometimes have to move very fast in prosecution, moving these cases forward. So identified that as a priority to expedite elder abuse cases and preserving testimony through deposition. So that was one of the pieces of legislation. We also wanted to signify in the statutes, in particular the criminal statutes, that elder abuse was a significant crime, and just like to kind of use the comparison of child abuse, we kind of mirrored things there within the statutes to make sure that we're sending a message, one, that this is an important crime to pay attention to, but also give law enforcement and prosecutors added tools to be able to go after those individuals when they do reach that point. Then we also worked with financial institutions and financial advisors to identify ways that they'd be able to prevent or stop abuse when they're seeing it. And what we've seen, and not just in Wisconsin, but we modeled it after what other states and some national models that we've taken in terms of legislation, to be able to give them the ability to delay these transactions when they reach that suspicious level, and then be able to bring in partners like Adult Protective Services or law enforcement to assist them with investigations. And then also provide them with, that older adult on the forefront could provide them with lists of trusted contacts. So maybe it's one family member who's the perpetrator, be able to reach out to other trusted contacts that they've provided, to be able to reach out, hey, this seems like very unusual transactions that are going through, and asking them if they know anything about that's going on. So a lot of those proposals were moving forward. They went through the state assembly and were getting ready to be voted on in the state senate. Unfortunately, COVID hit, and the legislature stopped meeting for the year. So we'll be looking forward to hopefully picking up where we left off here next year. And so again, some of the public awareness efforts that I talked about are detailed here. Again, it's really important that we're trying to reach older adults or maybe their family members that are out there that want to report abuse, because it can be really challenging for those individuals to identify where to go, or maybe that even if understanding that abuse is happening to them. So in 2018, really early on, we developed the Respect Your Elders Report Abuse campaign and launched statewide radio ads, and then that kind of dovetailed into creating more of an online media campaign for family members and others to identify abuse. And then also in 2018, we collaborated with the Wisconsin Bankers Association and Credit Union League on a training video for front tellers, and it really is a great resource for them, and I know they use it still to this day. I get a lot of contacts from outside of Wisconsin, people asking to get access to the video file to use in their other states. I think, you know, Oklahoma contacted me a few months ago to get access to it, and I was happy to give it to them. So it's a great, tremendous resource for those banks and credit unions to be able to, you know, identify and get those kind of red flags that a teller might see. And also in 2019, we received funding to create a statewide elder abuse hotline that hopefully many of you know about. I've got the website listed there too. So it's also an online tool that we'll be able to report on the website and, you know, get contact. And a lot of those referrals are sent back out to our counties to address. And then as part of that, in 2020, we kind of revisited our Respect Your Elders Report Abuse campaign by launching some online and radio advertisements that direct back to the Elder Abuse Hotline, and you know, have some great results thus far. And that campaign, you know, continues on, and you know, we're hopeful to, you know, continue the campaign on in future years. But I will say that funding is always a challenge, and advertising obviously is an expensive endeavor. So now I'm going to get into our Abuse in Later Life program. So this is the program that Bonnie had referenced, that her team at the National Clearinghouse of Abuse in Later Life, they're the technical advisor on the grant, and they are big, you know, basically they run it in conjunction with the U.S. Department of Justice. So I'm in close contact with Bonnie. So we first applied for this grant in 2017. It was started in 2000, so it's been around for nearly 20 years and has really developed over the years in terms of the things that they've tweaked within the program. And so in 2018, we were awarded a 3-year, $1.25 million grant. And so that program had helped fund 4 pilot sites within the state. And I'll get into more of the detail of what the pilot sites are doing. But we took Door County, City of Milwaukee, Outagamie County, and Oneida Nation as our sites. And so we took those sites as a pilot approach to be able to get some diverse populations from a urban rural mix, and a tribal program as well, to be able to really see what kind of differences we're seeing within those communities. And so when we applied for the grant, we had to get partners. We were talking about collaboration before, and it was really important that on the forefront we get a buy-in from all of those local agencies that are listed there, including law enforcement, adult protective services, victim services, and our prosecutors. So we all have individual teams within those communities that work very closely on the different aspects of the grant. So it's, again, it's not just one entity that's, trying to tackle this program, but really collaborating together to address the issue. And so there's 3 major components to the grant: trainings, victim services, and the establishment of a collaborative community response team. So I'm going to get into each of those different components in a little more detail, so you guys have an understanding of what the program does in those communities. There's a very heavy focus on law enforcement trainings. There's 2 different trainings for law enforcement. There's a 1-day training more for your frontline officers, so the ones that may be appearing or called into a scene, and it is taught again by a multidisciplinary group to show the different resources that are available and different perspectives that are out there. So we have law enforcement, a prosecutor, victim advocate, and APS that are the trainers for that program. Then we also have more of a training focused on your detectives, investigators, and supervisors, so they understand abuse in later life at that level, but get maybe more of that enhanced knowledge. So when those cases from those frontline officers are then handed off to them, especially in financial cases, they can really dig in a little bit deeper and have those tools that we provide for them. So we're training law enforcement in all those communities that I listed earlier. We're also trying to expand out in other areas and make these training tools available to other entities. So please do reach out if you want to train your law enforcement in the future. I'd be happy to hear from you and schedule something in the future or include you in one of our other trainings that are ongoing. We also have trainings for direct service providers. So that's taught by a domestic violence advocate and an adult protective service worker. And really the main purpose of that training is to, focus on victim safety and the quality of life for those older adults, and really kind of strengthen the collaboration among partners at the local level. So we're targeting other APS workers, community-based domestic violence and sexual assault advocates, your system-based advocates, which you typically see in your prosecutor's offices, and then kind of that broader aging network. So it's really whoever's providing services to older adults in the community. We won't really want them to be part of these trainings. And again, these are locally held trainings that we're doing in those pilot sites that I referenced. But again, would love to do more of these trainings in other communities as well. And then part of the grant, we send prosecutors out to nearly a week-long National Institute on Prosecution of Elder Abuse. We already sent, I think, about a half dozen prosecutors from our pilot sites out to this. We're looking to send some more this year, but obviously with COVID, all of the in-person trainings have been postponed. So hopefully next year we'll be able to send more prosecutors out to this institute. And I know really kind of the direct result out of this training, those individuals are seen as experts, not just by other prosecutors in their office on these issues, but sometimes other prosecutors from other counties are reaching out to them for their thoughts and opinions on some of these cases as they talk about them. And then also we have a judicial training. I want to say we almost sent 10 to 12 judges from Wisconsin, including from our pilot communities, out to this National Judicial Institute. And it's been kind of similar to the prosecutors. I know right out of the gate, there was one of the judges that Adult Protective Services had frequently complained about, that he just had a really bad attitude towards these cases. And they saw a sharp change in kind of his opinion after he spent his week out at this institute and really understanding what the different dynamics were of elder abuse. Then there's also other optional trainings that we're doing under the grant. We had some civil attorney trainings that were more webinar based this past year. There's also an in-person faith leader training that has just started being offered this past year that we may consider doing in the future. And so just a little bit about the training programs. This isn't something that has been developed kind of in a silo or just developed from one entity. The National Clearinghouse on Abuse in Later Life and the U.S. Department of Justice have really taken a lot of time to get input from people. And as I said, it's been around about 20 years, so it's really kind of developed over time in terms of changes they've made based on feedback they've gotten. And so the second component I talked about is victim services. So we had about $300,000 to spend on some of those services that are included here, those eligible things that we had to do. But we had to come up with a plan to be able to do that. And so how we went about that is we interviewed not just professionals to get their perspective on things, but we also worked one-on-one with older adults in those communities to get their perspective on where are the gaps, where should funding priorities be to better serve those individuals in those communities. And what we really found was that there's a lot of great services, not to say that everything is completely robust in every community, but there's a lot of services for older adults that are out there, but it's more challenges with accessing them or finding them. So ultimately what we did with our proposal, we hired some victim advocates to work in those pilot communities and really work one-on-one with victims to help guide them through the process, make sure they're following up on those resources, and kind of taking care of them throughout the process. So we partnered with the Elder Rights Project to be able to do that. So they have these victim advocates embedded within their program. And then lastly, the third main component of the grant is the coordinated community response teams. And so I'm not going to go into read through all of these. Many of you know what a CCR, typically they're seen in domestic violence and sexual assault, but there's been other areas of the states now that are focusing on a coordinated community response around elder abuse. And so in our pilot communities, we're starting to focus on this, and it's really different because it's not like your typical interdisciplinary teams that you may be more familiar with in the counties that you work in that are more case specific or more about information sharing. These are really about system change. So it's a discussion and planning that you're going through to change maybe the way you have policies or procedures, whether it's law enforcement or prosecutors, adult protective services, to better serve those victims and to better hopefully coordinate your response from different entities that are involved with victims of elder abuse. So I'm going to just list some resources here. I talked about the Elder Rights Project. Please check them out if you're not aware of them. The tremendous resource that provides free civil legal service to victims of elder abuse, no income limits on their program, and so they've been a tremendous partner here in the program. You heard me mention the Elder Abuse Hotline. There is the hotline website, reportelderabuse.wi.org. Of course, our partners over at the Department of Health Services, they got lots of great information on their websites as well. Another great resource for not just law enforcement professionals, but pretty much everybody under the sun is the U.S. Department of Justice's Elder Justice Initiative. They've got tons of videos on their website, a lot of different information throughout their website. So please check that resource out there as well. And then, of course, again, the National Clearinghouse on Abuse in Later Life has a lot of resources, some that Bonnie didn't mention. So please go there and check out NCAL's website. So now I'm going to move into our panel. Leslie, Alice, and Loreen, if you could be so kind to share your screens when you get a moment so other individuals can see your video. I'm just going to briefly introduce each of them. So Leslie, she's currently in the Administrative Division of Securities within the Department of Financial Institutions. She started her work there at DFI, serving as an attorney, and has worked in the Division of Securities Enforcement Bureau since 2002. In 2008, she was elevated to the attorney supervisor. And then prior to joining DFI, she worked in private practice. She is a graduate of the University of Illinois Urbana-Champaign. We won't hold her Illinois presence against her because she did get her law degree from Marquette University. And then Alice Page, she is the Adult Protective Services and Systems Developer in the Office on Aging at the Wisconsin Department of Health Services, and she's served there since 2010. She's an experienced attorney with a Master's of Public Health who has practiced law in New Hampshire and Wisconsin. Her past positions include Senior Policy Analyst at the National Bioethics Advisory Committee in Maryland, where she managed a project on ethical and policy issues and international research focusing on HIV/AIDS and other global public health issues. And last but not least, we have Loreen Glaman, who is with the Division of Criminal Investigation at the Department of Justice. She's a graduate here of the University of Wisconsin-Madison, and Special Agent Glaman obtained a degree there in psychology and social welfare. She began her job as a special agent with the Department of Justice in 1996, initially working in narcotics enforcement, and then in 1999 she transferred to the Wausau field office with the Gaming Enforcement Bureau. So she continues to work gaming investigations. She primarily investigates financial crimes and public integrity crimes. Over the past couple of years, most of her cases are related to financial exploitation of the elderly. Loreen regularly instructs on financial investigations and white-collar crimes and has organized numerous DCI white-collar crime seminars. Loreen resides in Wausau with her husband, who's also retired from DCI, Special Agent Ron Glaman, where they own and operate 2 businesses. And in her free time, Loreen enjoys working out and has been a certified professional trainer since 2002. She currently teaches a weekly boot camp as well at the local YMCA. So if any of you are looking to get in shape up there in Wausau, Loreen is your gal. So I'll first welcome Leslie Van Buskirk to talk about her perspective from the Department of Financial Institutions.
I guess I'll start out. First of all, thank you, Mike, so much for letting me speak at this, and thanks to Triad. You're probably not as familiar with the work that we do regarding elder abuse because it's really a smaller piece of the puzzle. We focus on financial exploitation that has involved a security in some way. The Division of Securities is a small division within the Department of Financial Institutions. We have 16 staff. Half of them examine and review applications for investment advisors and broker dealers, and the other half investigates enforcement issues that involve either registered or unregistered people. Our primary goal and our mission is investor protection, and I wanted to go a little bit because your case doesn't need to involve Google stock or a bad rep in order for us to become involved. If it's a security, it may be as simple as a promissory note that was given in order for someone to do their business. It could be a promissory note as long as it's a passive investment that there's an expectation of profit in the enterprise that could be a security under our law. And so feel free to contact us if you think that we could help with your concern. There are only a few things that are not securities that you might think are, such as annuities and insurance products or sales of a commodity that you obtain and keep. But you can still call us because we will investigate it to the point where we realize we don't have jurisdiction. And then we might know exactly who to send it to, and that has happened in the past. So, basically what our staff does when they get a referral is they'll interview the witnesses, review the documents. Our registrants are obligated to give us documents, so that's usually not a problem. And then like Loreen and most other financial investigators, we follow the money. If violations are found, we can bring an administrative action or refer it for prosecution. We collaborate a lot of times with other states. We've got this really awesome statute that allows us to share records freely with other government agencies and keeping them private to the extent that agency would keep it private. So there's really, we can really be helpful if there is a way to hook us into your case. The only thing that we can't really get involved in that we sometimes are asked is if there's a family dispute that involves a securities account. If the rep didn't do anything wrong and there wasn't a fraud in the security, we can't really get involved in that. But if a rep has violated the securities laws, we can look at it. If it's a Ponzi scheme, we can look at it. Bad promissory notes, all that. I also had some success stories of collaboration with other agencies, and I don't know, Mike, if you won't look, we should probably get to the others, and if we have time, go to my stories.
That sounds good. Yeah, we'll come circle back on some of those success stories. Why don't we move on to Alice Page?
Good morning. I am Alice Page. I am one of 2 staff that work in the Department of Health Services in the Office on Aging in Adult Protective Services. I have a wonderful colleague that I work with, and we are basically responsible for providing oversight and technical assistance training, facilitation, consultation to not only the 72 counties and 11 tribes in Wisconsin, but to multiple other partners that we work closely with when we're trying to resolve either specific cases or look at systemic issues involving abuse of adults, whether they're younger adults ages 8 to 59 or whether they're the elder adults who are ages 60 and over. As most of you probably know, the investigatory piece of adult protective services is done at the county level. All 72 counties investigate cases, and a few tribes, Indian tribes, do as well. The other tribes that don't do their investigations rely on the county APS staff to do that for them. But the county agencies basically are responsible for receiving and responding to reports of allegations of abuse of people that reside in their counties. APS is in many cases the first responder when there is a case of suspected abuse. There are numbers of cases where both APS and law enforcement will go out. If it's a particularly dangerous situation, law enforcement will go out, most likely ahead of APS, but APS will be probably on their heels, since it's really the job of APS is their first job is to keep people safe. So the counties will all of them have technically three agencies: an adults at risk agency for the younger population, the elder adults at risk agency for the older population, and then the APS unit, which is what I kind of refer to as the legal arm. This is APS has unique authority to take legal action in the form of things like protective placements, guardianships, protective services, and those kinds of things. So that when a county APS unit gets a call, it's their job, as I said, to receive the reports and to investigate. And what their goal of the investigation really is to determine whether abuse has occurred and what they can do to help keep the person safe. So oftentimes APS workers, when they get the call, will go out and they'll interview the individual who is suspected of being abused. They'll interview family members, as Mike, I think, alluded to, that many abusers are family members. In fact, probably the majority of abusers we see in Wisconsin are family members. They may interview caregivers, surrogate decision makers, for example, a guardian or an agent under a healthcare or financial power of attorney. They may go actually visit the residence of the individual, look at their living conditions, look at medical and financial records. They will assess the level of risk that the individual is under. They'll try to assess the decision-making capacity of the individual. They'll look at potential service needs, funding sources, and support, whether you want an intervention to be voluntary or involuntary. We always prefer that things be voluntary because that means that the individual is making the decision for themselves. It's not something that's being forced on them. So one of the great challenges of APS, and Mike asked a question of Bonnie about this, and Bonnie responded a bit, but we talk about this in the adult protective services world all the time, and it's that need to balance the protection of the individual with their safety. And we talk about it in terms of, we like to use the term dignity of risk. And what that basically means is that every choice that a person makes has risks and consequences. We do it every day. You and I do it all the time. And some people deliberately make choices to live with more risk than others, and they're willing to accept the consequences of their choices. So APS is always walking this fine line. We never want to impose anything on a person that has decision-making capacity. One of the great difficulties is that people may have decision-making capacity during one part of the day and not another part of the day, or with regard to a particular issue, but not something maybe that's more complex. So this is something it's this fine line that APS is always walking, and it really is one of their biggest challenges, because APS has to figure out in every single case, which is different, what it means to be safe, who should decide what that means, and when does the cost of safety sort of outweigh that, the benefits of autonomy and self-determination. So APS is, as Mike said, we're seeing the numbers of cases skyrocket. We're seeing financial exploitation cases skyrocket. Self-neglect is still the highest number of cases we see in both age groups, but it's financial exploitation, which is also often coupled with neglect, is right up there. And in addition to seeing an increase in the number of cases, we're seeing increasing complexity in the types of cases. And so my big takeaway probably at every meeting or conference that I talk about is the need for the development of relationships. And APS works with MCOs, we work with the Department of Justice, with law enforcement, with prosecutors, with the Division of Quality Assurance, which regulates facilities in Wisconsin. We work with crisis agencies, mental health providers. So all of these partners are critical for APS to work with in order for them to do their job. So this notion of building relationships, I think, can't be stressed enough. And we've worked with Loreen, we've worked with Leslie on cases and training, and we will probably, and Mike, of course, all the time. So we will continue to do that. But that is probably the most important component these days because of the complexity of the cases and the need to involve so many different disciplines and partners in order to resolve a situation. So I will pass it over to Loreen.
Thanks, Alice.
All right, can you hear me okay? Thumbs up?
Mm-hmm.
All right.
Yep.
I've already been introduced, so I'm not going to talk a lot about who I am, but I started working almost all elder financial exploitations in 2018. I'm a special agent with the Wisconsin Department of Justice, and I wanted to talk a little bit about what DCI is, because people don't know what I do or don't understand what DCI does. We investigate crimes of statewide importance. We're state-level law enforcement. So I'm a law enforcement officer, but I don't wear a uniform. I'm not state patrol. All that we do, there's about 120 of us in the state, is investigate crimes. And I listed on there what kind of crimes we investigate. I'm not going to go into it because there's not enough time today. About 2 years ago, maybe closer to 3 years ago, I was asked to look at almost exclusively elder financial exploitation, partially in response to the Elder Abuse Task Force that Mike talked about earlier. As part of that, I have really started collaborating a lot with local law enforcement because as one person in the state of Wisconsin, I can't do it all. As Alice alluded to, we really have to work together. So one of the things that I have become maybe more known for in the last couple of years is being somebody that law enforcement can call. As a law enforcement officer, I understand where they're coming from, but they can call me and I can kind of walk them through how to do an elder financial abuse case, or at least some pointers. There are some things that law enforcement has access to in elder abuse cases that we don't have access to, or we don't have the ability to get records quite the same way in other types of cases that law enforcement doesn't know about. Bonnie had mentioned early on that one of the it's not concerns, one of the issues with law enforcement is we have to know a lot about a lot of different things. We're not just normally investigating one area. And elder abuse is one of those things that unless you've had training on it, you might not know what resources are out there that we as law enforcement can access that makes our job a lot easier. There's ways we can get documents and things like that. So we work I work regularly closely with law enforcement and APS. APS will often call me and say, hey, I need help. And I'll say, okay, let's get a hold of your local law enforcement. And I'll try to work with local law enforcement. There are times when I will take an investigation myself. But again, with just me, and I do other investigations too. I'm required to do a few other things. I can't do them all. So my goal is to help with training and leading people in the right direction, leading law enforcement and APS in the right direction. Mike mentioned earlier that I follow the money, and that is exactly what I do. And I teach people, and I kind of walk them through on how to follow the money, because that's how we prove a case. There's a lot of things that happen in elder abuse cases that are concerning, power of attorney. Does that mean they have the authority to do this and that kind of thing? And my goal is to show that they don't have that authority, and in fact that they didn't use the funds the way they were supposed to. Mike put up an association chart. This is actually from a case that is ongoing right now, and that's why it's very generic. But my job and the job of local law enforcement and APS, because APS actually started this case that I'm going to talk about very briefly. They brought it to law enforcement. Law enforcement came to me and said, hey, I need a little bit of help. And so we basically looked at all these accounts, and you can see there's how the money came into the account. So if we look at the green line, the money came into this account, which is our victim's account. It was the victim's money. So we have to prove, one, that it's the victim's money, and then two, where was it spent? Was it spent, I'm just looking at the time, I know I'm close on time, was it spent on things that were benefiting our victim? In this case, you can see that $700 was spent on groceries, and our victim was in a nursing home where she wasn't buying groceries. And then you go and kind of look at some of those bigger ones. $8,000 were spent on veterinarian bills for our victim who doesn't have any dogs. So again, or cats. She lives in a nursing home. Some of the bigger ones, $3,000 on utilities and cable. That's not the victim's utilities and cable. So we basically draw this chart. This is kind of, we do it first of all through probably Excel, and then we take all those numbers, crunch them down, and we come up with this end result. This is what we hopefully will help the prosecutor and the jury and the judge see what was going on, and that our victim, in fact, her money was not used for her benefit. In this case, it was a sheep. I won't talk more, but you can see that in 2017, our victim had $128,000, and then 2 years later, she had $522 left, and her bills were not being paid in her nursing home, and she should have been able to live comfortably for much longer than her power of attorney in this case was allowing her to do. So that's what I do. I follow the money. I help others learn how to follow the money. I direct them. I do some cases myself, but I can't do that many of them. It is collaborative effort. All of us, APS, social services, not always APS, and law enforcement all work together. And I'm right at time, so sorry.
No, you're fine. We are a little bit about to be over momentarily here, but I think we can hang around for a little bit and ask any questions that folks might have here. You all are great resources, and glad to have you. So we'll open it up for questions if folks want to ask them in the chat box. Let's see here. One person had asked, what is a security, Leslie? Maybe you could explain a little bit in kind of layman's terms on exactly what is a security.
Well, the primary feature that makes the security different than other kinds of investments is that it's passive, and you're expecting someone else to do the work to make the return. It could be just interest, but usually it's a situation where, there's the typical stocks and bonds, but often it'll be a promissory note that someone is using to raise money for their business. I'm starting a business help finance me. Sometimes it's, well, sometimes it's not even money. Sometimes you're giving something else of value, like turn your property over to me, and then I'm going to use it for this business, and we're going to make some money. That can be a security. You guys don't have to worry about that, because if you call us, we will worry about whether it is or not, and we're happy. It's really important to us to work with you guys, because elder fraud is so important to us. The elder citizens have worked so hard to accumulate their assets, and when those are taken by someone, especially if it's in a scam, there is almost no chance of getting it back, and there's no time for elderly people to re-earn it. And so it is a very important thing for us.
And can I just mention, we had a referral which involved, I can't remember exactly what kind of document, but there was some, professional representative or agent that we felt that we had received a complaint that they had scammed some money off of somebody. And I did not understand sort of what the person actually did for a living and how it worked. And I sent it to Leslie, and she said, well, this isn't our domain, but it is actually insurance. And so Leslie sent the case to the Office of the Insurance Commissioner, and the guy's lost his license. And we had, so it took a few hops to get it to the right place, but Leslie was able to pass it on to the right people, and we got this guy's license yanked. And so so anything that's sort of financial that isn't clear cut, where there's an insurance agent or some sort of a stockbroker or whatever, Leslie can get those to the right people. So you don't have to know exactly what's going on, but if you know Leslie, she will.
Yeah, I'm very happy to do that.
Yeah, that's a tremendously great example of collaboration and working together. That more and more is happening, but we need to have more of it happen across the state. We've got a couple more questions. One question came in about asking about cases. How many cases are reported in Dane County each year? We don't have that right at our fingertips. I would say, we've reached over 10,000 cases of elder abuse that are reported across the state. I know Milwaukee County is probably close to 1,000 of those. I'm not entirely sure. So Dane County might be a little bit lower than that. I can certainly follow up with that individual afterwards. And I guess the second question, I think this is probably a softball for you, Alice, but they're wondering, is there adequate personnel in not just Dane County, but in counties in general to investigate these incidents of elder abuse?
Well, I think as much as I would like to answer yes to that question, I can't answer yes to that question. We've talked about the fact that we're seeing increased number of cases, particularly as the baby boomers age. We're seeing more complexity in our cases in terms of there may be surrogate decision makers. The victim may have multiple medical or behavioral health conditions. They may be enrolled in family care or IRIS program. I mean, they may be living in a facility, some of which are regulated in Wisconsin, some of which are not. And so the cases are just so complex and so difficult. And the caseloads, even 5-7 years ago, were pretty daunting. And now they're just going through the roof. Resources are stagnating. And so it is very difficult. I know that counties are, particularly the larger counties like Dane and Milwaukee and some of the other counties that have got large numbers of cases, they have to prioritize their cases. And You know, they have to respond to the cases where someone is in danger, or the danger is greatest, or the risk is greatest. So there is that need for APS units to prioritize their cases. And oftentimes, one of the other things that's starting to happen is that my colleague and I are starting to gently push APS workers to go into facilities when there's alleged abuse. It used to be that APS, the county APS workers, would only go in when the alleged perpetrator was someone not related to the facility. Say it was a family member or a guardian or somebody that, you know, was not employed by the facility, and then the county APS unit would go in. But what we're finding now is that, this is a gross generalization, and it does not apply to many facilities, but we have certainly been involved in numbers of cases where the facilities are not doing their job, and they're not complying with their regulations, and they're not reporting suspected incidents of abuse to the Division of Quality Assurance. And when the facility isn't doing their job, then it becomes the job of APS and law enforcement to step in and do what the facility should have done. And they go in and they will investigate. They will then report to DQA. They'll try to pull somebody in if necessary. So we're starting to see these cases where we're telling the APS worker that your job doesn't stop at the door simply because it has a sign that says nursing home or community-based residential facility. And this is becoming more and more of a problem. So it's just only adding to the workload that Adult Protective Services has. So that was a very long answer to your question, but unfortunately the answer is no.
Thank you. We don't have any other questions at this point, so I think we'll just wrap up. I appreciate all of you on the panel giving your perspective on these things. It's really helpful to hear from other individuals working in the field. If any of you didn't have any questions that you wanted to ask, or you want to follow up with anybody individually, my contact information's here. I'd be happy to connect you with any of these panelists, or connect you with Bonnie Brandel, or if you have any other general questions related to this topic, I'd be happy to assist you in any way. So I'll wrap things up for today. I really appreciate everybody that was able to log in. I hope you have a great rest of your day and weekend, and hopefully we'll see you here again next week for our next session starting at 10 a.m. Thank you, everybody.